So, are you getting the correct dose from your asthma inhaler?
Well, why wouldn't I?
Well, that might seem like a funny question for me to ask you. However, there's a management tool that can make sure that you're getting the correct dose to your lungs. It is called a spacer. When using just an inhaler, you may not realize that most of the medication goes into your mouth and hits the back of your throat, and a lot of the medication just gets swallowed into your stomach. This picture here shows you the difference of how the medication can reach your lungs using a regular inhaler and a spacer. And as you can see with the spacer, most of the medication reaches the lungs.
I don't use a spacer, but maybe I should. After seeing that comparison, it seems kind of weird.
You're exactly right. It's kind of amazing to see how much medication you're losing by just using an inhaler. Let me show you how to use a spacer correctly. First, you'll have the spacer and you'll have your inhaler. The first thing you need to do is remove the caps from both of them. Then you'll need to shake your inhaler. You want to place the inhaler in the back of the spacer. Once you have this done, you're going to want to exhale slowly to get all the air out of your lungs. Then you'll place the spacer in your mouth. Press your inhaler. The medication will then go into the chamber, and you will want to slowly inhale it into your lungs and hold your breath for approximately 10 seconds. Once you do that, you can take the spacer away and breathe regularly. One thing to remember is that there are a lot of spacers that will whistle if you are inhaling too quickly. You want to just make a nice gradual inhale. If your doctor has recommended 2 puffs, you want to wait 1 minute in between and then just redo the steps that we just talked about.
Well, no offense, but I don't really think I can carry that around all day with me. It's too big.
That's a really good point. When you contact Breathe Pennsylvania and you get your student asthma kit, in the kit is something called a paper spacer, and I think this would work better for you. It works just like the regular spacer. It lays flat and you just pop it open. You would follow the same directions that we went over for the regular spacer. You'll shake your inhaler and you'll place the inhaler in the back of the spacer. You're going to want to exhale completely, place the spacer in your mouth, press your medication, and inhale slowly, then hold your breath. Remove the spacer, breathe normally, and repeat if your doctor has advised you to do so.
That's a lot more convenient.
Remember, spacers help deliver more medication directly into your lungs. Some spacers will whistle if you inhale too quickly. Be sure to inhale slowly when using a spacer. For your convenience, Breathe Pennsylvania's student asthma kit includes a cardboard spacer.